What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Wednesday, August the 12th. Always a pleasure to have you with us today. And I'm especially excited today because I've got a Hawaiian on the show with us. We've got two dentists. Maybe you're not excited about talking about going to the dentist, but these people will make it nice for you. I want to introduce you to a husband and wife team from Healthy Smiles. We have Dr. Philip Batson and Dr. Liz Abe. Aloha, Dr. Abe.
Aloha.
Good to have you here. You're from Hawaii. First of all, and Philip, you're from the Midwest. How did you two meet? How did you end up marrying a beautiful Hawaiian lady?
Very lucky, for one. But we met in school, and there's always been a contingent of students from Hawaii at the dental school in Kansas City. And I got to be really good friends with the ones in my class, and met Liz then via our mutual friends, and kind of took off from there.
And that's the rest of the story.
Yeah, and yes. Kept you in the Midwest.
Yes.
Right. So you went to dental school together. Philip, your dad was a dentist. In fact, he was my dentist for many years. Now you're my dentist. But so then you just, after you got married, you decided that you would form this the new company as a partnership, right? You're both dentists together.
Yes, yeah. So our goal was to work together, and we were just kind of waiting for the right opportunity. And about a year ago, we were able to combine and have the practice be able to accommodate both of us. And
right.
So it was kind of a culmination of a goal and a dream of ours that we got to do it.
Well, continued success with it.
Thank
now,
you.
This has been a difficult and unusual time in dentistry with the coronavirus outbreak. How are you handling that?
Well, I think things are changing all the time, especially in the beginning. But, we were closed for, we were just in emergency only for about 7 weeks or so. And has gradually started to see more and more, and we're happy to do so.
Now, do you find that people are a little reluctant about coming in to have their teeth cleaned in this pandemic? What precautions are you taking to put folks at ease?
Well, we've implemented a thorough screening process prior to patients' appointments.
Okay, so how do you do that?
We do a phone screening prior to the appointments. Just when we're confirming or checking, we run through a checklist of questions. And then on the day of their appointment, when they arrive, we, of course, everyone's in a mask, when they come in, and staff and team included. But then they have their temperature taken, and we have another screening set of questions for day of. And then we limit the number of people in the reception room at any one time and in the office at any one time. We limit waiting time, if any, in the reception room, have them get to the treatment room as quickly and expeditedly as possible.
So do you make people wait in the car until it's time for their appointment, or do they?
That's an option if they want to, but it's not a requirement.
Okay. So when you come in, let's say you're coming in for just the routine cleaning. Mm-hmm. What's going to happen with the cleaning?
For the patient, it should feel pretty normal. As far as what we do on the back end, we do take extra precautionary measures to make sure everything is clean, and waiting between patients, and spraying and aerosolizing the rooms.
Are you concerned at all the fact that you are working on, you're so close, now obviously you have masks on, but you're so close to the patient, you're almost in their mouth. Does that concern you at all, working on someone that in close proximity?
So a new thing that we've also done is we wear face shields for a lot of our procedures, and that helps as well. So a mask and a face shield.
So you're wearing mask and face shields.
Yes.
And we've also introduced additional extraoral suction devices so that sit outside of the patient's mouth that can grab more of anything that's aerosolized. So that's an additional tool and precaution that we're taking now.
And that's for your protection.
That's for our protection and
Right.
our team's protection. And so just another it's these new things that weren't done before that we've begun that we've implemented.
Exactly. So I think the patient can feel at ease the fact that you not only you're wearing masks, but you're wearing the face shields also. So the patient is pretty well protected.
Oh, absolutely.
And as far as any of the procedures that you were doing, is there anything else that you wanted to mention that has changed as far as what you're doing?
Well, there's the additional PPE that all of the team are wearing. Of course, the masks that all the team are wearing at all times. In the office when interacting with each other, interacting with patients,
And changing between patients.
Everything is now changed between patients.
Okay.
So anytime there's any sort of aerosolization, gowns.
That's all changed
everything
between.
is changed between patients.
So when you go in and examine someone, you've got the garment on, or the gown on,
and it's a
and
new
before
garment.
the next one comes in, you change that.
Yes.
All right.
Yeah.
That's got to be adding expenses too.
It does. Our laundry, is being done a lot, but
That's good to know.
Yeah.
That's good to know, and it's important to do.
It's all worth it for the safety of our team members and our patients.
Okay. In the short time, we've got less than a minute here. What can we all do to keep our teeth healthy?
I'll defer.
Brush daily.
Brush daily.
Or twice a day. And a lot of it has to do with diet, too.
Yeah. Stay away
Yeah.
from candy
Yes.
and sweets. And if you eat
Sodas.
almonds, be careful with the almonds because they can crack your dad always told me that. He'd like, are you eating almonds because you can crack your teeth real easy if you eat those whole almonds? So
we've seen a lot of cracks from almonds.
Yeah.
They're healthy, but man, they can be hard on teeth.
okay. If people want more information, your website is?
It's www.columbiahealthysmiles.com, and we have an entire section devoted to COVID and all the precautions we're taking on COVID on our website.
Okay, so go to the website www.columbiahealthysmiles.com, and you can, if you have any concerns, check what you're doing for COVID-19.
Absolutely.
All right. Thank you so much for coming by today. I wish you continued success as a husband and wife dental team, Columbia Healthy Smiles. They both got
you.
beautiful smiles, especially your little Hawaiian lady there. Aloha to you once again. We're out of time. pepperpmissouri.edu. Bye-bye.